Assalamu alaikum and welcome to the Dr. UT lectures. The topic of today's discussion will be about the Congo virus. This is actually the common name of the Congo virus, but now we'll discuss with you guys the complete discussion regarding the topic. Somehow complete, not complete, but somehow, okay? Well, this is actually called as Crimean Congo hemorrhagic fever virus, or you can also call it as Crimean Congo hemorrhagic fever virus. Now, this is actually a virus, given the name this long. Now, why this name is given? Let us know first of all that. This name is given to this virus because of its, first of all, discovery. When this virus was discovered, it was actually discovered in these two regions, Crimean and Congo. These two were the regions where this virus was actually discovered for the very first time. This is one of the coastal area of the sea, Black Sea, and somehow a river in the Africa, South Africa. So then after that, the name was further elongated because of its action on the body. It was actually causing the hemorrhage, means it was causing severe bleeding. And along with that, it was causing a severe type of fever. So because of which this virus got this long name. Congo virus, which is a simple name, a common name right now that is actually in the surrounding. And the complete name, that is Crimean Congo hemorrhagic fever, is given to this virus because of its origin, its discovery, and along with that, its actions on the body, because of which this virus is given this name. I hope you got a little bit of history of this particular name. Now let's come towards the pathogenesis of the virus, how this virus is causing the hemorrhage, or how this virus is causing the severe type of bleeding, and how this virus is causing the fever. First, let us know that. After that, we will talk to you about the signs and symptoms, the treatment, the transmission, the diagnosis, and etc. Okay, so now let's come towards the very first point, the pathogenesis of this particular virus. Now, what is the pathogenesis? Simple. Is this virus, Congo virus, or you can also call it as CHFV virus or CHFV virus. When this Congo virus actually enters inside the body and it gets its way into the cell, it will start replicating itself. Means it will start making its copies. As it makes its copies, then it will cause the body to generate a kind of immune response. This is very common. When something enters our body will generate immune response. Okay, this is our responsibility, the responsibility of our body to generate an immune response in order to protect our body from this particular virus, bacteria, or anything that is coming to the body, that is invading our cells. Okay, so our cells are supposed to be protected because of this what immune response. Our immunity, our defense mechanism, our army is supposed to fight against this particular virus. So what is happening then is this virus enters inside the cells and it replicates itself and it starts making its copies, and then in the meanwhile there is immune response being generated, and if the virus is enough having enough strength, this virus will cause the destruction of the endothelial cells of the blood vessels. Here we have our blood vessel, which is a normal blood vessel. What is supposed to happen? The blood is supposed to flow inside this blood vessel. When this virus actually enters inside the body and the cells, so the endothelial cells of this blood vessels, they are actually a kind of damage. So what will happen there? Due to that damage, the endothelial cells will no more be available, and due to which what will happen? Small pores will be actually seen in the endothelials, in the blood vessels, and from which the blood will start moving out. So it is actually making the vessel leak. So from the leak vessel, what's supposed to happen? Simple. A vessel is leaked, so the blood is no more going to able to move through the vessel. Other it will actually start moving from the vessel outside, away from the pores. So now blood is no more available in the blood vessel. Now it is moving outside from the blood vessels. Okay. So what will happen then? Then the hemorrhage will be seen. Hemorrhage means several type of bleeding will be seen. This is how bleeding is caused actually. And in the meanwhile, you might have heard that there is actually decrease in platelets count in the patients. Now, how that is actually caused? Very simple. During this entire mechanism, what is happening actually? There is dissemination of the intravascular clotting. Means several types, so many actually clotting factors are actually used hereby, and several cascades are actually being disturbed. In short, several use of platelet actually is happening. Platelets are used way too much, due to which what will happen inside the body. One here, one here, one here, one there, means hundreds of clots will be formed inside the body. I'm just giving you an example. So many clots, and in the meanwhile those clots will be destroyed again. So formation, destruction, okay, all these are actually happening, and in the meanwhile platelets are actually used. due to which platelets count will get down. This is the point, that how the Congo virus is causing the platelets count to go down. So, okay, so this was all about the hemorrhage, means the bleeding. Why bleeding is actually being seen or observed in the patients, those who are affected by the Congo virus. That's all. Now let's come towards the fever. How this Congo virus is causing the fever. Well, this is actually the mechanism that will help you out with any type of antigen or anything that is coming inside the body, whether it is virus, bacteria, or anything that is coming inside the body. So our body will change the temperature. It will increase the temperature. Our body temperature will be increased because of that thing. How it is increased, let us know that first of all right now. Well, when anything enters the body, now it is actually the Congo virus. It can be virus, it can be bacteria, it can be anything. When that enters the body, so now guess what? It is a virus. Okay, Congo virus enters the body. The pathogens will be released by our body, and sometimes the virus, the bacteria can also release some kind of chemicals or pathogens which are responsible to induce fever in the body. Okay, so now how actually fever is induced? Let us know that. When these all viruses, bacteria and stuff, especially when this virus enters the body, our body will release endogenous pyrogen. Those pyrogens, those chemicals like interleukins, TNF, tumor necrotic factors, those chemicals, they are responsible to move inside the body, in the blood, okay, and they will reach the brain, where there is a center of that is responsible to maintain the temperature of the body, that is known as hypothalamus. That will actually then sense this particular chemical, and due to which that will our hypothalamus will switch and will increase the temperature of the body. Now why the temperature is increased? Because of what? Because of this alarming situation that something outside, something unwanted is actually entering our body, or it has entered our body. So now this is our response. Hypothalamus says this is my job now to restrict, to hold on that particular thing, means to constrict the area for that thing. So due to this high temperature, what will happen then? This high temperature will restrain, or you can say will stop the growth of that particular antigen, if it is virus or bacteria. So now what will happen? The temperature will rise. Now high temperature is actually responsible to make the body condition unfavorable for this virus, so that the virus may not further cause the harm to the body. Okay, so this is actually a kind of protective action that is being shown by our body. Virus enters into the body, that our body starts really identifying this virus. This is not our own particular beneficial thing, it is actually the thing from foreign side. So we have to fight against this, and we have to do something. So in the meanwhile, the pathogens are released. Those pathogens move in the blood to the brain. There is a center known as hypothalamus, and that hypothalamus will be then switched to increase the temperature of the body, and this increased temperature is responsible to halt the growth of the virus, to stop the growth of the virus. Okay, so this is beneficial now, this is beneficial action, and that's why we say the fever is actually a kind protective action that is being shown by our body. It is protecting our body, it is protection type of mechanism, okay, that is being shown by our body. Due to what? Due to entry of any antigen inside our body, it is whether it is virus, bacteria or anything. So that is about the fever, how the fever is actually induced by the virus or bacteria or anything that enters your body. So this can be placed for anything that is actually causing or inducing fever in you, in the body. Now let's come towards the this particular virus. Where does it come from? It has got a vector, that is actually tick. So it is actually a tick-borne virus. These ticks are actually parasites. They suck the blood of the animals and the humans if they get in touch with you or with anyone. So what happens then? Then the virus is actually transferred from the tick bite to the particular animal, and if we take or if you consume those animals, especially like cattle, and anything that you take from in the meat form, so raw meat, or if you interact with the infected animals or with the humans, individuals, okay, so what will happen? Their body fluid, their blood, their interaction is actually a source of transmission to you. You may be you may get that particular virus. So this is how the virus is actually transmitted from the ticks to animals or humans. So tick bite is actually the very common factor, the very common point. So from here, it is easy to transfer the virus from the tick to humans to animals. So then what is the sign and symptoms? Before I move towards sign and symptoms, remember this point. The incubation period of this virus is actually 3 to 6 days. And if somebody is getting recovered, within 10 days of this particular infection, the person will become somehow okay. And if the virus has got the power, has got the rule, or has controlled your body, then within 2 weeks or a second week of the infection will be actually the week that will lead to the death of the patient. You can say death of the patient is actually kind of confirmed by them. So further signs and symptoms include headache, fever, nausea, vomiting and diarrhea, and muscular pain, abdominal pain, sleep conditions are actually disturbed, and depression is actually seen. Liver diseases, liver becomes enlarged, eyes and diseases or infections, lung infection inside the body. So many disruptions are actually seen. So then we have diagnosis, how to diagnose this and how this is actually diagnosed. Remember, guys, these are actually the tests, and these are not actually the standard tests, but they may help you out with the identification of the presence of this particular virus in the body. That is RT-PCR, reverse transcriptase polymerase chain reaction, ELISA, cell culture antigen detection test, and so other tests are actually done to confirm the presence of this particular virus inside the body. So these are actually the diagnosis tests that are actually done, and somehow the symptoms are actually also signs and symptoms are actually also assisting us to do confirm the diagnosis. Well, regarding treatment point of view, remember guys, no exact treatment is there, but some medication like RIBA, complete the name of the drug. It is antiviral drug. So this is actually responsible to treat this. Not responsible. This is actually seen in some patients that it is actually showing somehow action. But if it is done, if it is diagnosed early, in the early stage, there are chances that the patient will recover. Otherwise, if we go in a late stage, then hemorrhage is actually the stage which will tell us that the patient will no more will be available to have life. Anyways, لن تموت نفس حتى تستكمل رزقها. I believe that. What is the translation of this hadith? Write down in the comment box. Thank you for watching Dr. UUT lectures.